Yeah, my name's Cam McLeod. I've been in Revelstoke for 13 years now. I work at the Selkirk Medical Clinic. That's where my family practice is. I also provide emergency coverage up at the hospital and hospital inpatient services. Yeah, I'm speaking on behalf of Selkirk Medical Group physicians, but I also have a fairly good feel for healthcare in Revelstoke. I mean, that's a challenging question. In the time that I've been working, we've certainly never seen anything like this. I think we've got a fantastic and dedicated team of frontline providers that are willing to go the extra mile. Everyone's going to pitch in and do everything they can as this unfolds, whether it's physicians, nurses, administrative staff. I've got full confidence in the team. Mm-hmm. That said, you look around the world and what's happening in places right now, places like Italy, and I think we all have this fear in the back of our mind that that could potentially happen here too. The places that have had the most success, I'm sure you've heard the analogy of flattening the curve at this point, and really it's about trying to, if we do everything right and the public does everything right, then hopefully we'll be okay, and hopefully we'll be able to slow the progression of this disease as it goes across Canada to a point where at least healthcare services aren't completely overwhelmed. And I think that's really our goal going forward. At the clinic level, we've made, these might sound like minor changes, but in terms of how we run our business, I think they will be fairly significant changes over the next couple of weeks. Just simple things at the door. We've changed our signage in the clinic. We will be really emphasizing, so people that have mild, moderate upper respiratory symptoms that come to the office or call ahead, generally we'll be discouraging them from even presenting to the clinic. We're going to be trying to implement telehealth visits for those patients consistently over the next week or two. We've not done that before. I'm sure there'll be some glitches, but hopefully that will unfold uneventfully. And the point behind that is really to keep that higher risk group away from frail elderly or other people with chronic illnesses that might also be in the wait rooms, try to separate those populations as much as possible. So at a clinic level, that's what we're really focusing on: cleaning procedures, having dedicated rooms in the clinic that we're using exclusively for patients that we think might be at risk for COVID. We're discouraging. We've stopped recalls. Like, we have recall systems for people with chronic health conditions. We're going to put those on hold for the next month. Routine recalls for things like pap smears and stuff we're going to put on hold for the next month. And people that have non-urgent visits, we would tend to encourage them at this point to maybe put those off for the time being until we have a better idea where things are heading. So those are some of the basic things of the clinics. On the larger scale, hospital scale, the communication channels certainly are open. It's been several months now of fairly constant communication from Interior Health Administration, from the provincial health officer. We get daily email updates from those groups. That's been very helpful. There's new lines of communication we've always had a good working relationship as physicians with the IH administration, but we're meeting with them now on a very regular basis, probably almost daily, I would guess, for the next week or two. And also with our own clinic staff here too. I know there's meetings. I'm not involved with them specifically, but looking at contingency for use of operating room space if that were ever needed in Revelstoke as things unfold. Lots of different processes going on in the background. We have I think this could be said for most communities in Canada, but we operate at near maximum capacity for much of the year. And I just worry about our buffer if this unfolds the way, the worst case scenarios predict that it might. Hopefully that doesn't happen. So it's our ability to deal with a surge capacity appropriately. If cases trickle in one at a time, serious or not, we can deal with that. But if we get a surge capacity, we've got a small group of physicians in a small hospital, yet we've got a community that, we have a lot of international tourists. Based on our size, sure, it's a small population, but I would suspect that we are at higher risk in Revelstoke than some of the other smaller communities in Revelstoke of becoming a bit of a hub for COVID cases. That would be my main concern. I think also looking at our demographic, we've got an interesting mix of older people with chronic illnesses mixed with a younger demographic of relatively healthy tourists. I worry maybe that, and maybe I'm not giving enough credit, but that younger people may not take this seriously. Things like some of the common sense precautions that the BC CDC is recommending, hand washing, taking seriously recommendations of self-isolation. I worry that maybe some of our demographic won't take those seriously, and by doing so might put the older, and I keep saying older, and that's not fair because a lot of people with chronic health conditions are younger too, but put that vulnerable population at risk. And beyond that, if our system gets overloaded, then we don't also have the capacity to deal with ski hill injuries, to deal with backcountry injuries, snowmobiling injuries, those sorts of things too. So everyone will be worse off if those sorts of common sense recommendations aren't followed.
Okay.
I think so, and exactly, because of a lot of the points I touched on, right? I mean, I think, we're talking about a hospital that has the capacity to ventilate 2 people at a time. And every case that we can mitigate makes a huge difference in our ability to manage the cases that do come through the door. So it'll be, hopefully if everyone does what they're supposed to, physicians, healthcare workers, but the greater public as well, in terms of their role in preventing transmission of this, then hopefully we'll be able to get through this. And it would be great 3 or 4 months from now to look back and say we all overreacted, as opposed to wishing we'd done more. And so some of the recommendations may seem at this point, without any active cases in Revelstoke, may seem unnecessarily vigorous, but when you look at what's going on in the world right now, I think it's really important to take the public health recommendations very seriously. Yeah, and so that's a big question, and that's I'd step back a little bit, and I would say, first of all, who's at risk, right? And if you're at home and you've got symptoms, what should bring you into the clinic? The people that are identified at risk right now are people that have, and I'm kind of quoting BC CDC recommendations, but are people that have a cough or a fever or shortness of breath and have had a recent history of travel out of the country to a place where there is local transmission, or they've had contact with a high risk or a confirmed or probable case. Those are the people that are felt to be at the highest risk. Now, the travel recommendation over time is that if we do see higher incidence of COVID, may be eliminated from all of that. But, for people that are at home that have symptoms, you develop a new cough, you may have had some travel, you may have had some exposure, then the question is, well, what's the next step? And what we're trying to message to people as much as possible is the first step is really to call 811, the HealthLink BC hotline. If you can get through and talk to a nurse there, they're probably best equipped to do that initial triage and direct you, whether you're sick enough to go to the emergency department or whether you should come to the clinic. Regardless of what the recommendations are, we would say call ahead. For the clinic, if you call ahead and you've got symptoms that may be consistent with COVID, you're probably going to be recommended by our staff to stay at home. And what they would do is set you up with a telehealth appointment with one of the physicians. And then that physician will call, and then they can talk to you about the pros and cons of getting tested or further assessment, whether it's necessary. The truth is, right now, we have limited testing ability in BC, certainly at least in Revelstoke, in terms of the sheer number of tests that we can perform before we run out of swabs. That may change, but at the moment that's the case. So what we're doing and what has been recommended that we do is that for people with mild symptoms, even if it's possible COVID, we're not recommending testing. We're recommending self-isolation, and you recommend self-isolation in those scenarios for usually, I think it's about 7 days until the fever, 7 days minimum, and if there's no fever on that 7th day, then you're able to leave isolation at that point. That's the current recommendation, and again, this situation is dynamic, so for updated information in that regard, I'd recommend going to the BC CDC website as well. For people that have, that do warrant testing, we would generally refer those people after a video conference up to the hospital for testing if we feel that that's necessary and appropriate. There's an isolation room at the hospital that we're planning to use. There's also some talk about setting up a mobile offsite testing that has but an offsite testing That hasn't been done yet, but we'll hopefully know more about that in the weeks to come. And then if you do get tested, then a person would be expected to self-isolate at least until that test came back negative.
Mm-hmm.